back into education. Has something to do with it. There's a question like, how do we heal medicine? We have a big problem with our country that we have really high cost healthcare, and it's ineffective, our medicine. And this is Atul Gawande. I think that's how you say it. That's how he said it. So. But he proposed the question of how do we heal medicine. He proposed that we should have less cowboys and more pit crews, which is like saying instead of being an RN, you would go and be like a licensed practitioner instead, like you do one lower. So that way you could utilize everybody at the same time. And he calls for a system work, which is basically everyone together with more education. He also asks, is it the insurance fault that we have such high cost, or is it the legislation's fault that we've put it in to act? Atul started in research. He started out in the Women's Hospital in Boston as a surgeon, and while he was there, he wrote for the New Yorker. He wrote this thing called, it was about McAllen, Texas, that we have the second highest healthcare in the United States. So medicine before penicillin, he brings up the fact that before we had the education that we have today, medicine was ineffective, costly. Most time was trying to spend, finding cures, but instead of finding anything, you were basically handed a little bit of warmth that you had somebody there. That's about it. Now, medicine is more of a craft. We have more education. More people are being able to go to have that education through technology. And we used to be independent as a nation because we always trying to get that world power. We're going to be better than the other one. Same thing with our education, anything else. We want to be independent. But now we're trying to everybody come together globally. That's the goal. We have 4,000 new medical procedures since 1937 and 6,000 new medications that have been prescribed to cure. 2 million people this year are leaving hospitals with an infection that they did not have when they went in. And that can simply be cured with a checklist. These checklists are like if an airplane went off, you want to make sure that you have gas, your pilot's okay, everybody's seated. Same thing, you have it for before the patient goes in, while the patient's there, and afterwards. And our future healthcare, Medicare, Medicaid, and all the other benefits that we have are slowly depleting because of our population growth. So he says that systems of pickers and specialists are needed so that the systems work together. We can work with education, we can work with all other types of groups to make this a realistic thing. His checklist, the skills that we should practice is that we recognize success and failure in our practice, being able to devise solutions for all the problems, and then the ability to implement it globally. So this is a sample of his checklist. I know it's kind of blurry, but I thought it was really important to see something like all the ones that he has before, during a skin incision, and then after the patient leaves the operating room. And down at the bottom it says up to a year later, which could be even more if it's a longer thing, but that's what he gave it as an example. Checklists give you an opportunity to encounter a problem while it's still in a fixable state, so medicine is more able to help you. There's more than one way to do a checklist. Although he does provide 6 different opportunities, you can make up your own. And he says there's no recipe for surgery, only a recipe for the team that makes up the surgery. So he's more about educating. Also, it was implemented in 8 hospitals globally already, and after that, 15,000 people had no longer had infections. They say that poverty, here's a really good quote how he explains it. Making systems work is the great task of my generation of physicians and scientists, but I would go further and say that making systems work, whether in healthcare, education, climate change, making a pathway out of poverty is the great task of our generation. So going back to education, we are no longer trying to be an individual nation. We want to do it globally. So we're kind of connecting to all these other different countries and reaching out for that achievement gap, especially with technology. Systems. He brings up the question, is our education system more advanced than the medical system? The reason of this is because, skill 1, we've already looked at the problem, we've already devised, we've already pinpointed our problems. 2, we've already devised solutions by reforming education, why we have to take, so many classes different. And 3 is making that free and effective education for all, closing that achievement gap. Just by taking this class alone, we're reaching other people. And that's our resource.